RFK Jr. is absolutely the most dangerous nominee to run HHS in our history. Absolutely the most dangerous person. This is me speaking as a physician.
That's Democratic Governor and medical doctor Josh Green of Hawaii, who we've had on the show before talking about his concerns. He joined Democratic senators today in voicing their concerns over RFK Jr. and the risks they see for the nation if Kennedy takes charge of the Department of Health and Human Services. One of the senators raising the alarm alongside Governor Green is the senator from Hawaii, or one of the two, Brian Schatz, and he joins us now. Senator, you said, quote, millions will die, unquote, if RFK Jr. is confirmed. That is an alarming accusation. Can you explain?
Look, this is a person who has gone out of his way to cause disease. He's flown across the planet to cause outbreaks. And in Samoa, he went there and 5,700 people got the measles and 83 people died, 79 of whom were children. And what he said to one of his coworkers was that this would be an opportunity for data collection. Now, the only time the United States government has viewed a disease outbreak as an opportunity for data collection was during the Tuskegee experiments, which my father, Dr. Irv Schatz, was one of the first doctors on the record to come out in opposition in the late 60s and early 70s. That is a dark period in our history during which the federal government withheld life-saving medicine from people that they deemed to be expendable to observe the disease process. And that is RFK Jr.'s view of public health and specifically vaccines, that we need, quote unquote, population-wide studies. What does that mean? It means that you give half of the population the actual vaccine and half of the population a placebo and see how it plays out. We are not a population that wants to be experimented on by this person who lacks any expertise in this area and has gone out of his way to cause disease across the planet.
So on that matter of your island neighbor, Samoa, and RFK Jr.'s role in the spread of disease there, just to bring people up to speed, we've talked about this a number of times on the show. We've also talked about your impressive father, the first whistleblower of the Tuskegee experiments. Kennedy visited Samoa in 2019. The year before, the government of Samoa had briefly suspended measles vaccinations because 2 children died, not because of the vaccine, but because some nurses made mistakes with the vaccine. Kennedy's trip to Samoa was arranged by anti-vaccine advocates. He wrote a letter to the Prime Minister of Samoa questioning the vaccines. And here's how Kennedy responded today to questions about this. Oh, we don't have the SOT. Okay, well, in any case, he said, in 2018, 2 more kids died from the MMR vaccine, and the government in Samoa banned the MMR vaccine. That's measles, mumps, and rubella. I arrived a year later when vaccination rates were already below any previous levels. I went there with nothing to do with vaccines. I support the measles vaccine. I support the polio vaccine. But as you note, I mean, the numbers you gave, they had more than 5,700 measles cases within a year of his visit to Samoa and 83 deaths, mainly children. So what's your response to what Kennedy said?
Well, he said a lot of things that aren't true during the hearing, but I think what Republican senators in particular have to grapple with is what he's done over the last several decades, right? Everybody says what they feel is necessary in order to get that confirmation vote. And so suddenly he's saying he's not anti-vaccine. But look, even some of the things that he said in the past, I think he said Lyme disease was a bioweapon. He said COVID was targeted towards African Americans and somehow not targeted towards Ashkenazi Jews and people of Chinese descent. Like, he's really out of his mind as it relates to public health. And I think one of the things that we need to kind of understand is there are a lot of people who agree that the food system is not working for Americans, that we are making people increasingly obese and sedentary with ultra-processed food. HHS is not in charge of the food system. That's the United States Department of Agriculture, and that is the Farm Bill. So if there's an opportunity for reforming our broken food system, I'm all in. But this guy is going to be in charge of preventing infectious diseases, in charge of investigating the efficacy of drugs, and most importantly, for the purposes of their confirmation vote, making sure that we keep the level of rubella, measles, mumps, polio below a certain level so that we don't have outbreaks of diseases that have been in our rearview mirror for decades, even generations. And so I just don't think this vote is going to age well. If people make this person in charge of HHS, it's not one of these things where it's going to be ambiguous. We are going to see outbreaks of disease because this person has a particular view of vaccines that is way outside of the mainstream. It has nothing to do with like how people view about COVID policy or, you know, whether the government, state, county, federal did all the right things during the COVID outbreak. That's not this. Even if you have a certain kind of view about COVID policy, I assume 95% of Americans don't want rubella or mumps or the polio disease to come back.
Senator Brian Schatz of Hawaii, thank you so much, sir. Good to see you.